Hi, my name is Jamie. We are going to be doing a IV push and a subcutaneous insulin injection today. I am going to start by assessing the medications we're going to give. The first one is furosemide, 20 milligram IV push every 12 hours, administered over 2 minutes with a 3 ml normal saline flush before and after. And this is being used for edema and blood pressure. And also insulin, Lispro, 10 units subcutaneous with breakfast for control of blood sugar. These are both due right now, so we are going to gather our supplies and make sure we have everything. First though, our patient's name, her name is Millie Larson. Her date of birth is January 1st, 1936, and she has no known drug allergies. The supplies that we're going to need is our insulin, our furosemide, some alcohol wipes, so tape for labeling. I have my pen for labeling as well. We have an insulin needle. This insulin needle, it says it holds up to 1 ml. And we have 2 normal saline flush. We have a 3 ml disposable syringe and a needle for drawing up our furosemide. I have a 25 gauge 5/8 inch needle here for that. So I've got all my supplies together. We are going to check to make sure that we have the right medications, and we are also going to check the expiration date on these. This is our insulin Lispro 100 unit vial, and the expiration date on that is good. Next is our furosemide, 100 milligrams, 10 milligrams per ml. The patient's order is 20 milligrams, so we are going to be giving 2 ml today, and the expiration date on that is good as well. All right. Sanitize my hands here. So we've checked our medication against the MAR as we got our things together here today. We're going to be checking, obviously, again. We are going to do 3 checks in total, with the last one being at the patient's bedside. So we are going to draw up the insulin. The first thing I'm going to do is I'm going to take an alcohol wipe and open that, and we are going to break the top off of our furosemide vial, and we are going to clean the top for about 15 seconds. All right, and that is clean. We want to open our syringe. And our needle. We are going to be attaching the needle to the syringe and removing the cap. I'm going to draw back on the plunger. Again, this is for the furosemide, and we are going to be drawing up 2 mLs to equal 20 milligrams. You need to inject the air into the vial and then pull back so that we have two ml. All right. I'm going to tap out any bubbles. And then to recap, we slide it back on. And I'm going to put that over here. Next, I'm going to write the name of the medication on the tape and the dosage as well. So that is our furosemide again, and it is 20 milligrams. This is especially helpful when we have 2 injectable medications, even though they are not the same syringes, to make sure that we are administering these appropriately. The next thing we are going to do is clean off the top of our insulin vial. Again, this is going to be for 15 seconds. We're going to take our insulin syringe and this is for 10 units of insulin. So we draw back the plunger to the 10, insert the needle into the vial, push the air in and pull back on the plunger. We want 10 units of Lispro insulin. All right. Again, make sure there's no air bubbles in your needle. And we want to safely recap that as well. That also needs to be labeled. We are going to be labeling that as Lispro insulin 10 units. And we put that on the syringe. All right. The next thing we are going to do is go into our patient's room. And we are going to bring our supplies with us. So we have our flushes and our alcohol, and we have our medication. So I'm going to identify my patient. For patients who cannot confirm their name or date of birth, we are going to be looking at the wristband, and her wristband says that her name is Millie Larson and her date of birth is January 1st, 1936. No known drug allergies. This matches the MAR, so we can proceed. We've provided privacy for the patient, and I am going to explain the procedure. Millie, today I'm here to give you an IV push of your furosemide. Furosemide is being used to control your edema and blood pressure. After that, we are going to be administering some insulin. The insulin is being used to control your blood sugars. The patient does not have any questions. She is familiar with these medications. I am applying more hand sanitizer prior to starting my procedure. I'm going to put on some gloves now that the hand sanitizer is dry. All right. So before we can administer anything through this IV, we need to first clean the lock, and we are going to do this for about 10 seconds. Next thing we're going to do is open our saline flush. These saline flushes are 10 mLs. We're supposed to be administering 3. So we are going to attach that and make sure we are only administering 3 ml. That is done. Put the syringe to the side. Next, I got my medication. This is the furosemide, and it is 2 milligrams. We know this because it's labeled. We can remove the needle. The needle can go into our sharps container. And then we are going to attach the medication to the lock. This is to be administered over 2 minutes for the sake of time. We are going to make those 2 minutes go by much faster, but if we were doing this to an actual patient, we would make sure it was slow and smooth over the 2 minutes as prescribed. All right, that medication is been injected through the IV line. And we are going to then again flush another 3 cc's of normal saline. We do this to make sure that the medication is flushed through the line and not sitting in the line as we want it in the patient. 10 cc's syringe of normal saline. And we are administering 3. So we are taking that down from the 10 to the 7. And we will get rid of that syringe. All right, our IV push is done. And my lights just turned off on me. I apologize for that. I will be back in just a second. All right. My lights are an auto timer here and they keep shutting off on me, so they are back on. So before we can proceed with our patient, since I walked away from her, I will do hand hygiene again. All right, our next procedure here is going to be our insulin injection. This is a sub-Q injection going into the patient's upper outer aspect of her arm. I would ask the patient if there's any reason she shouldn't have an injection in either arm. She says that it doesn't make a difference. Either arm is fine. So we are going to do this in her left upper arm. I've got my alcohol wipe and I am cleaning the area. We clean that from an inner to outer circular motion, and then we are going to let the alcohol dry. I have my insulin. We're going to again check to make sure we have the right medication, the right dosage for Miss Millie Larson. And this is 10 units of Lispro. We labeled it before we brought it into the room. We are going to be grabbing between our thumb and forefinger, gently squeezing the area to administer between this, and again, this is the upper outer aspect of the arm. The injection is going to go in between a 45 to 90 degree angle depending on the size of our patient. We want to make sure it gets into that subcutaneous layer, and it's going to be a dart-like motion. I'm injecting the medication. I'm gently pulling out the needle, and we are engaging the safety as soon as we pull it out. I have a gauze over here, and we are going to apply pressure just for a second, and we can take tape to make sure that stays in place. We could also use a Band-Aid. I don't have a Band-Aid handy, so we are just going to use the small gauze. All right, and that is our subcutaneous injection. We are going to appropriately dispose of all of our syringes into our container here. And take off my gloves. I'm going to make sure that Millie is in a comfortable position. She has her call light where she can reach it. She doesn't need anything else right now. So I am performing hand hygiene again before leaving the room. When I go into the hallway, I'm going to be documenting that we gave this medication. It was administered appropriately by signing with my initials on the MAR. And for the insulin, we are going to also record the injection site. And that is our medication administration for the IV push and subcutaneous insulin injection. Thank you for watching.